Everyone to the second round table, which is on evidence and governance for service delivery, identifying gaps and avenues for collaboration. So we're in this round table going to focus more now on the using knowledge. On using the knowledge in Indian context. We've got a somewhat reduced panel. Most of the panel cancelled. Some at somewhat short notice. We did think about trying to get replacements. We thought it would be a good opportunity actually to allow more participation. We have a very rich audience with many, they're not in the eight of wealthiest in the world, that rich. I mean, they're very rich audience in terms of experience, and so it'd be good to draw on them. So we have Indrani Gupta, who's Professor and Head of Health Policy and Research at IEG. She has a PhD in economics from Maryland, but was active in India since then, setting up the Health Policy Research Institute at IEG, which is one of the few places really doing policy-oriented research for health using economic analysis. And she's worked with a wide range of institutions, of course, such as the World Bank. It seems to be a common theme. If people on the panel, you have to work for the bank or the fund, and of course with the government of India. She's interested in a wide range of health-related economics issues, health financing, property and health, costing, cost effectiveness, and so on. And we'll no doubt hear some more about that. Rohini Somanathan, who is Professor of Economics at Delhi School of Economics, has a PhD from Boston and worked at various places in the US, Emory and Michigan, before coming back and first working at ISI before moving to the Delhi School in 2005. She's got actually quite a wide range of interests related to public policy, but looking particularly at the sort of ideological environment in which state policy is created. They're talking about work on public goods, microfinance, child nutrition and environmental health. So it's quite a broad range, but some of that is quite focused on the issues we have in front of us today. So, bringing in the discussion now to focus on the health issue, I'd like to, also on the national policy issues, I'd like to start by asking Indrani to share experiences of working with government at both national down and at state level to try and mainstream and utilise the use of policy-oriented research. Thank you.
Thank you, Howard, and thank you 3IGDN and everybody else for inviting me here. I was sitting there thinking what exactly I should say that would add value to this discussion, frankly. So let me just, I will focus on your question, but maybe I'll just give you my own thoughts about how I feel research has been used in the sector that I know the most, health sector. I think the experience has been rather mixed. I wouldn't say it's been all bad, but I'll tell you what has been good and what hasn't been that good. Health sector is very different from any other sector that we've discussed so far, and it's also different from the education sector to a certain extent, and I'll tell you why I think so. So our experience has been, and I'm in Delhi at the National Institute, so mostly my work has been more at the national level rather than at the state level. So there are questions that are very specific to the various states, and there are questions that are very national in nature that needs a national approach. Now, let me focus on the latter part. Health sector is different because we know markets fail, we know all the standard economic logic, but there is also a very good reason why the health sector is slightly different than even the education sector. That's because of a series of stakeholders we have who have different interests in the health sector, deeply entrenched, that might prevent policies from taking place, to a lesser or greater extent. Policies that are not seen as conflicting to the policymakers, and they could be even outside the government, are more easily implementable when there is evidence that there is, something has to be done. Evidence is not asked for, I feel, and I apologize to the government if anybody is here. I don't think the demand is quite there if there are many conflicting groups associated with a particular level of, or a particular set of questions. Example, we know that health regulation in the health sector has been overdue for a very, very long time. We have a lot of evidence that, we could do regulation at various levels with the providers, with the service delivery, etc. It hasn't really happened. And it's not quite so much because we don't have evidence. We have some. We don't have very good evidence in terms of RCT, etc. But we have enough evidence where we don't need more evidence to actually inform policy. That's one part of it. Areas where you actually need more evidence would be areas such as National Health Protection Scheme, something that we have been working on. I work a lot on universal health coverage, health financing, for instance. And I find, and I'll tell you an interesting anecdotal story about how we have interacted with the policymakers. When the new government came in, the National Health Assurance Mission was set up. And we were very happy that we were invited, some of us, on that particular panel. And we were saying, okay, we'll do the right thing to do about UHC, not go the insurance way, etc. And we did work very, very hard, pro bono completely. Did the government take into account what we had to say? No. Why not? We don't really have good answers because we never asked the government what happened to our report. But we believe, some of us believe, that it could have been because we were not very big, let's say, on insurance. We wanted to strengthen the primary healthcare sector, etc. Things that were not seen as very jazzy. Now, it could also be, and I'm just speculating here, it would also be because there may have been some other I'm trying to be mild here, other way the government would wanted to move forward, which wasn't really quite squaring with the way we had devised this whole thing. Another example is in the last budget, there was a scheme announced for health protection that gave supposed to be 1 lakh for every citizen, etc. And for hospitalization expenses. The reason why I'm harboring on this is that we have produced so much evidence, many of us, not, I wouldn't say a lot of people have been working on health financing, but a fair number of researchers, autonomous researchers have been working on health financing. We've produced evidence to show that it is really outpatient expenditure that is the most important. Hospitalization expenditure is poverty inducing, but if you don't look at OPD, then you miss a big part of the story. You really need to look at data. NSS exists. There are other kinds of data that show how much people spend out of pocket, etc. A fairly good amount of research has been done. More can be done. You don't even need RCTs in this instance. But we find that the government has not gone back to the drawing board to ask the right questions about universal health coverage, and that's why we think it's still a dream, distant dream in the country, though we are so propelled by international, agendas, priorities on UHC, rightly so, I think, but we are not at all ready. And we are not ready because we have not been able to compile the body of evidence that we need to inform policy making on UHC. However, when we worked on, there was one last example I'll give, and I'll just wind this up, I know time is short. I worked a lot in the economics of HIV and AIDS once upon a time. And in our insurance policies, there was an exclusion clause for people who were HIV positive, and I think PSI, was instrumental, but the government was also stakeholder. We all worked together to produce evidence, economists as well as clinicians, to show that actually the percentage of people who are going to be impacted would be so small that the insurance companies need not be worried and exclude people from this. That kind of worked because there was a huge amount of public exposure, and also stakeholders came together, and the government was a big partner into that, and something worked there. So at the end of it, I believe that there are some areas, and also HIV/AIDS was, remember, very much under the global scanner. It was really a global thing that was happening. So I believe in the working with the government in the health sector, and let me just also say that we feel very disappointed that the government doesn't call upon us as often as we would like them to, because I think some of us don't say the things that they probably want to hear, or there could be other reasons why. Maybe they don't think the research is worth anything, etc. So I want to wind up at this point by just saying that in the health sector, there are topics that are low-hanging fruits for the government. They can easily take them on board, either because of international pressure or because of other big stakeholders who are involved. That's a win-win situation, so everybody benefits from that. There are certain areas of research where the evidence is there, and if the evidence is conflicting, and the evidence is actually possibly not the kind of evidence the government wants to hear, those are not really touched on, and they are not picked up. Thirdly, I think the government needs to make much greater effort to, and 3IE and Campbell and all the other organizations that work on evaluation, much more initiative on trying to partner with autonomous research institutes. Now, the reason why I say autonomous is that somebody in the last panel mentioned, I think Howard, you mentioned, that who should be doing the research. In Thailand, we have a very good example of how closely the Thai government works with this organization that produce evidence, and course correction is so possible. In India, if you become a part of the government, then there is always a danger that it's going to be business as usual, and you don't produce the kind of evidence you need. At the same time, if you leave it to the Autonomous Research Institute, there's a disconnect. So we need to bridge that gap very nicely, and hopefully we'll make a difference in the times to come. Thank you.
Thank you very much. So, Rohini, Indrani actually has been fairly negative about the extent to which government has been using evidence to date in India, particularly in the health sector. So, based on your experience, what do you think we can do, or not we, but the Indian research community can do to better advocate for more use of research and policy by government?
So I was wanting to say something about the questions on my list.
So that is on your list.
So it seems a strange question to ask at some level, should we use evidence more? Well, obviously, if evidence is really evidence, it's a great thing, right? It's like saying, should we have better health, better food, the environment better? Obviously evidence is great. And I think the discussion that's really worth having then is what constitutes evidence. And I think this is not an easy discussion. So Howard talked about counterfactual and factual evidence, but I think what we really need to figure out is the ways in which we currently use evidence, what we call evidence, and randomized control trials. I want to say a little bit about them, both because they've been talked about quite a lot today, and because I suppose I feel we need to push back a little bit from them. So let me talk about that. So clearly we've realized, I think randomized control trials and experiments of all sorts did a huge thing. They transformed the way we think about development. I think we have the people who actually promoted these to thank them for that, because you went through many years where you put something on the left hand side, and then you put a bunch of things on the right hand side of a regression, and then you'd come across another paper that took something from the right hand side and put it on the left hand side, and this happened all the time. And then what is a causal effect in that setting? And I think that the experimental people, the folks, really forced us to ask that question of causality. Right? So that's said and done. And it helped us ask a lot of questions that we really couldn't. For health and education, for example, we knew that expenditures didn't constitute quality, right? But then what did? And it allowed us to make some real headway there. Why do I want to push back now? Okay, so I think that randomized control trials are great when you have a very specific question that you need to ask, when the intervention is obvious. Okay, so if there's one way that's very obvious of making things better, then you want to know how much better does it make it? Is it worth the costs? And you have a clear question to ask. If there are 250 ways of making things better, you're never going to have a randomized experiment that will tell you which way to go. Okay, that's one reason. The other reason is that when you think about the people doing randomized experiments, these are people who have standing in the academic community and who need their experiments to be tightly done, well worked out. And these are expensive experiments. So I think randomized experiments are expensive. Much more importantly, though, is there lots of situations, and I think this is where I would disagree with Mani. I think his example of the Gujarat regulators is an outlier. And I also think you could have figured that out without the experiment, honestly, that you could get other people to come and give you advice. But I think they don't work well when we have lots of things that need to be changed simultaneously to make things better. So if you're in what we would call in the economics jargon, a partial equilibrium world, if what you're doing is thinking about some guy or girl out there trying to make a decision of how much to buy, should I go to a school that exists, okay, then I think they're great, because they can tell you about how behavior in isolation is best targeted by your policies. All right? If, on the other hand, we're really talking about issues that are fundamentally general equilibrium issues, if, I don't go to school because the teacher is not there, the teacher is not there because, there's a labor market that, she has something else to do, if the curriculum is not good enough and she doesn't enjoy teaching it, whatever, if she's forced to go out and do the census when it's actually teaching time, and all those other kinds of things. So when you're thinking about a general equilibrium model, then randomized experiments are very status quoist. All that they can do is say, you're sitting at an equilibrium today. I change one little thing around, and will you change what you're doing? And, you'll get an answer. I think that even when you get an answer, that answer is close to worthless. So what situations am I talking about? If I talk about discrimination, if I talk about segregation, okay, here you need to do big things. Okay. So there isn't, we've had 20 years of work, we've had tons of correspondence studies, randomized, on discrimination. All that those studies have been able to tell us is that there is discrimination, that even when you basically, anonymously send out CVs with the same qualifications, people will discriminate if they think that they're from a different race or caste or whatever, right? We don't have any clue in terms of policy on how to fix the problem. And yet, if we actually thought theoretically, if we went back to Thomas Schelling and said, look, there's a puzzle here. If you ask people, are you okay marrying someone? Is your daughter okay marrying someone of a different group? And more people seem to be saying yes. And yet, when we look at residential segregation or caste segregation, we find it enormous. And then you'd say, yes, obviously, because there's a set of neighborhoods, people are already there, and then the question that you're asking is, given what everyone else is doing, is one person willing to move? What you're not asking them is, if we completely re-engineer things, we had a really diverse school, then would you be willing to live there? We don't have an experiment out there, or we have very few. We have some cities who've done this kind of thing. It's worked remarkably well. So all that I'm trying to say is that I don't doubt the knowledge that comes out of randomized trials. I think they've done a fantastic job, right? I think we've gone too far in thinking about them as a gold standard, both in the areas in which they operate, but also in their ability to ask a whole range of questions that we really need to ask. Okay? And here, coming back to what we can do, I think we need to realize that there's a fundamental, we talk about the synergies between academics and policymakers and institutions that are trying to improve the world, right? And of course, that's what we'd like to think of. I as an academic would like to think that I have a lot to offer to everyone else and they should listen to me. Okay? But I think what I don't emphasize often enough is that there's a really important conflict of interest here. Okay? Of course, I need people to think that's what's happening. All right? But a lot of what I do, if I want to be published, I'm a junior researcher, is guided by my discipline. Okay? And there are fads in what is trendy, what will be published. There's a certain threshold of scientific, what should I call it? There's a certain amount of technique, there's a certain amount of statistical validity I have to show my results to have if I am to be published, right? That's not the kind of thing that's ideal for a policy-making world, both because the costs are high, but very, very importantly, it cannot evaluate big national programs. So I can't come into India and say, we're doing it, it won't be very well published. We can't come in and say, look, there's this huge midday meal program, or there's the NREGA, or there's this big thing that's completely churned things around, and I'm going to look at it, and this is the effect that I get. Because they'll say, well, what's the right counterfactual? On the other hand, if I go to 20 different countries and do more or less the same thing, then I can say, well, you know, this works in these many countries and it doesn't work in those many countries. So I think there's a bias in research, and all of us, we want to do things other than research. We live in this country, you know, we have various other agendas we want to follow, which is apart from the research agenda. But I think it's important to be aware that that's not always the thing that will get us the highest number of brownie points. And I think that conflict of interest, I just wanted to be upfront about that, because we often dismiss it. So what can we do? I think that's what Howard wanted to know. So I just wanted to say my bit. I thought about the questions you sent me. Okay, so I think 3 things we should do. Okay, one is we need to strengthen research capacity, and I'm really acutely aware of this. About a few years ago, we were trying to revamp the PhD program at the Delhi School, and a lot of people, we have a lot of distinguished alumni who are faculty all over the world, and a lot of people told us, look, we do the PhD stuff well, you have the best master's program in the world, why don't you just do the master's and we'll do the PhD? And the reason the PhD program really mattered is because of this link with ground reality, because someone, you know, doesn't have to wait for the summer to go and collect data on a question that someone else has already asked. They can look at the newspaper and they can see what's going on, and they can go and decide, okay, I'm going to work on this. So for example, somebody wants to work on prohibition in Bihar because it's just come in, and see whether it reduces violence. And that kind of thing is possible. That's one reason. The other is that PhD programs are really going to service this huge, all the undergraduate programs that are there in the country. And so we really need to provide people who will do that. Okay? We need to get curricula at the undergraduate institutions. A lot of the IITs are now going in for a BS in economics. We need to get that on the right track. We need to think about what we really need to teach. So we need to strengthen capacity. The second thing is we need to match incentives. So the point of saying that there's a conflict of interest means that we need to give academics and policymakers a reason to engage, because that engagement is vitally important. Which means that academics have to provide policymakers something that's useful for them tomorrow, the day after, right? And policymakers provide access and are willing to hear the truth. So we need to make that happen, and we need to think about how those incentives are aligned. The third thing, I think, it's been made abundantly clear, I think, by Santosh earlier today, is that we really need to engage with government. It's crucially important, because the resources that they control and the regulation, through regulation, the decisions they control, quite apart from these resources, they're just, you know, wide-ranging and have enormous impact. And just one note, have I gone over time? Okay, so just one other note, coming back to these, it's become a bit of a bee in my bonnet, so coming back to these control trials for a minute. One of the problems I found with them is that when do you go in and see whether something has worked or not? And we do plenty of control trials. I mean, many PhD students are doing these. When do you go in and see whether it's worked or not? And what comes to mind, you know, Abhijit, Esther, and Angus Deaton had this long project in Rajasthan, which was wonderful. They collected a lot of baseline data. They looked at the health system. They looked at who was there. And then they had this paper in the JEA called Putting Band-Aid on a Corpse, which was just a fantastic title. And so what they found was they put in these machines to monitor whether people were coming to work or not. And they worked really well initially, and then, you know, they were broken and basically useless at some point in time. So the question is, when you bring in an intervention and you talk about evidence on whether it works or not, when are you looking at whether it works or not? Okay, and this is a huge question. So, you know, I'll end with a couple of examples from my engagement with government. You know, both it's made me think it's important, and it's also made me think that you really need to think about time scale here and when you're measuring evidence. So I was on a committee a few years ago to formulate solid waste management rules. My friends will know I'm obsessed about plastic bags. So there's one of many obsessions. But one is plastic bags and plastic in general. So I wanted to be on this committee, and we framed these rules. There were lots of people there. There were people from government, the private sector, NGOs like Chintan, Toxics Links. There were lots of people. And so one of the things I wanted to get in as an economist, based on evidence from the rest of the world, was explicit pricing. that just if you're going to use a plastic bag, just tell someone that you're paying 5 rupees or 1 rupee for this plastic bag. You have to tell them and charge it separately, because we've seen lots of evidence that this has worked in other countries in the world. So we put it in. Nothing happened. This was in 2011. I knew because it was the end of my sabbatical year. Nothing happened. And then last year, I go to a shop and they say, oh, that's 5 rupees for that bag. Nothing happened. So when you say, did government listen? Well, there's a lag there as well. And suddenly something was going on. What made it happen? I have no idea. I have no idea. The other thing was this outdoor. I was on a committee last year. Well, it's now 2017, so 2015. A health ministry committee for outdoor and household air pollution. Again, I think people listened. The report was widely publicized. People got interested in it. So I think that the footprint of government is so large that we just have to think of ways of engaging with it. And I think when they don't listen, it's often because people are taking hundreds of decisions a day. It's not because they don't want to listen. Sometimes that's the case. But a lot of the information I've got in what would be a good experiment to run has been from government. In Bihar, Amarjit Sinha was the Secretary of Education, and he told me something that was so simple as an intervention that I would just never have thought of. And he had done it. He just said, what we did is we took attendance registers, because there was a lot of absenteeism, and instead of putting a 0 for whether someone came to school, we just made these cumulative sums. So on the second day, it was 2 if you'd attended 2 days of school. On the third day, it was 3. It cost no money. Why would it make a difference? Because now if you want to fudge those attendance registers, you have to rub out 30 numbers and not a few numbers, And it was absolutely brilliant, I thought. And then, where are you going to get that idea from? Only when you're desperately trying to make the system work, and there are lots of bureaucrats that are trying to do that. And then you think, look, why don't we just do this? At that point, someone can come and evaluate it. It costs nothing, So that's it.
Okay, thank you very much. So back to you, Indrani. I'm paraphrasing, but if you think I've departed much from the question you're expecting, please feel free to go back to the question you're expecting. Okay, good. So, and we've been talking about engaging government with increasing demand for research, but of course there are many other stakeholders in civil society for research as well, and in many countries actually building a demand for evidence amongst the public through the media, for example, has been an important channel towards policy influence, because the pressure builds from the population, general population, to actually have evidence used. So what in India do you think are different channels, different groups of stakeholders that can be responsive to the evidence agenda?
I will say one thing here, just to pick up on something Rohini said. In the health sector, it is absolutely true that the action is at the state level, and the states seem to be doing much more than the central ministry. Now, there is a bit of a split personality of the government in this thing, and so that apart, I think yesterday, I don't want to be very controversial or provocative here. There was a piece of news that the NTAGI, the National Technical Advisory Group for Immunization, I'm a member of that. Things have happened to the NTAGI, as all of you know, and organizations are possibly by some group or another seen as threats to government decision making. Again, I'm not going to comment on whether that's right or wrong. But I think that there is a very uneasy relationship between the government and organizations that are seen to be pushing for technical evaluation. Partly it is because exactly what Rohini said, the government doesn't really have the time to do research, do RCT, I mean, where is the time? They're 99% of the time they're firefighting. But at the same time, there are some big ticket evaluation questions that are begging to be, answered and asked. And again, I agree with Rohini that need not be RCT. It could be some very elegant econometrics other than RCT that could answer those questions, or even just statistical analysis of means and modes. That the government hasn't been asking anyone to do. And also, it is sitting on a pile of data, huge amount of data the government has itself because it collects a lot of data. Now, it can easily give over this data or ask for partnership from these various stakeholders. So you're talking about NGOs, and there are INGOs, international NGOs that are working, there are research groups that are working, there are autonomous research institutes. There are a lot of those stakeholders who are interested in partnering with the government. And I don't want to sound alarmist here or anything, but I think there is a need, at least in the health sector, for the government to open its doors wide and let people even come in and tell the government what questions should be asked. I think the problem in the health sector has been the government doesn't even know what questions should be asked in some areas. For mother and child, for RCH, I think they have got a much better handle on that because there are many other influences on that agenda, including women's group, other NGOs, international. But for non-RCH related issues within the government sector, I work with NCDI, I'm on the Lancet Commission, we do a lot of work with, and we keep saying we don't have champions for NCDIs, non-communicable diseases and injuries, and that's true. So I think that championship may come from the research community, may come from INGOs or NGOs. That kind of collaboration needs to be forged, and at some level it is there, but it stops at those committee meetings and round tables. It doesn't go beyond that. So, it's not enough to show that in a particular year you interacted with this foundation, that foundation, this research institute, that, and these people are on your committees. It doesn't really mean much, I must say. Ultimately, whatever has been planned does happen, and it has its own, momentum. So coming back to a very sharp, precise question, I think we've gone, some way, but there's a very long way to go. And also, let me say this, that at times, maybe the government is right. At times, there could be other reasons or other agendas or other priorities that some other organizations are bringing into the country that we need to be looking at these things very carefully. So we can't just say that, okay, well, whoever wants to do economic evaluation, let's just go with them. Maybe not. Maybe we have to be very careful, but those spaces have not been created to even look at those agendas. So what I'm really saying is that we really need to have many more interactions with the government on a multi-stakeholder way so that we, know which research questions we want to answer, we know who the friendly parties are, and we also know the methods of doing those questions. And remember that government, I can talk about the health sector, we spend about 1% of our GDP on the health sector. Of that, research is minuscule amount. Now, where is the scope to do expensive RCTs? We don't really have either the time or possibly the wherewithal to do that. We need partners, therefore, because partners have money and the government doesn't have the money. So partnerships are necessary. Research questions have to be asked. I think we really need to create those spaces and work with outside stakeholders much more.
Okay, thank you. So as Indrani has reminded us, the attempts of international organisations to directly influence policy and practice is somewhat in the news at the moment. So from your perspective as a researcher, Rohini, what would you say is the role that international research might legitimately play in national policy in India?
I think one big thing with international research is that institutions are different, countries are different, and they do different things. And if we want a sense of how to be different, we really need to look across the world and we need to look at history, right? So you often hear in India, but we've always done that. But that's exactly why we're exactly where we are, right? You need to have, so for example, it was looking at the international research on environment and solid waste that made us put in those rules for explicit pricing and for other things. So you get ideas by looking at other people's experiences. Otherwise, you're just frog in a well, and that's the biggest advantage. But I also think it's vitally important for this research to be carried out in geographically different places. For me, it was, if you look at Europe and the US, for example, their priorities as far as climate and environment are concerned are very, very different. And the politics has been very different. And I think it made if all the research was to go on only in the US, then you wouldn't really get as much research on some of these environmental institutions. You'd have it much more on tax subsidy kind of stuff. On the other hand, if, it wasn't in the US, then you wouldn't get a lot of things. Innovation really comes from looking at what other people are doing, and I think that's the biggest gain from international research.
Thank you. Okay, so now I'd like to open the floor. I invite both contributions as well as questions, but if you are going to make a contribution, please try to keep it short so everyone has a chance to speak. If you are going to speak, would you please first say who you are and then make your contribution or question. Thank you, Robert. And can you please wait to get the mic until you start. Thank you.
Thank you. Robert Chambers from IDS Sussex. I'd like to ask you whether there is scope for diversifying the approaches and methods which are used for research. Having listened to the discussion through the morning, it's been very focused on certain approaches. I haven't heard the word participatory once, and you can tell me if I've been sleeping. But I haven't heard it, and yet, and particularly in relation to policy making and influencing policymakers, we've had an explosion, a very, very exciting explosion in the last 20 years of participatory methodologies, and they're exploding at the moment. And the range of choice of ways of finding out, and also the ways of choice of involving people like policymakers in the research, so that it's not a sort of foreign thing, which the research starts and it ends up with a report which goes plop. There is a huge range. For instance, if you just take ICTs, participatory ICTs are very, very diverse and have huge potential and have been very effective in policy influence. If you take participatory statistics, they tend to be much, much more insightful and more accurate. I'm making these assertions without evidence, and I can see Howard is smiling. But anyway, assertions without evidence. Generally more accurate and insightful, and also credible than statistics which come out. And credibility is very, very important than statistics which come out in other ways. And the reality check approach, which involves researchers going and staying in a range of communities for a week and having conversations rather than doing research. This has been very influential in Bangladesh and in Nepal and in a number of other countries, but not yet in India. So my question to you after all those assertions is, do you think that there really is scope for diversifying and that we tend to get too much trapped in the same ruts which are academically respectable?
Okay, thank you. Gentleman on the same table.
Well, I was about to say my name is Sudarshan. I work as the Dean of a School of Public Policy in a young university called the OP Jindal Global University. I was, going to ask what Robert has asked, but I also want to say there's sort of a politics about this, about evidence. I'll just give an anecdote to illustrate that, and to be about 25, 30 years ago, when I worked in the Ford Foundation, we funded the Maharaja Sayaji Rao University in Baroda in the Department of what was called Home Sciences to do a double-blind study of the impact of a mega dose of vitamin A and deworming tablets to school children with remarkable results. And we went to present those results to Montek Ahluwalia in the Finance Ministry, and he heard us politely, and end of story. Many years later, a similar experiment was done in Kenya, I think, by JPAL, and Michael Kramer, whoever it was who did it, was invited to the Planning Commission and feted, and Monte Ahluwalia was all agog, learning about the same results that had been done in this Home Science Department in Baroda. So there is a certain, so you need a bit of glamour and international and so on for people to take notice, and that's very sad, because the kind of work that the participatory groups in the country have been doing, the bottom-up planning in Kerala and so on, don't seem to somehow have this. So you mentioned fads. There seems to be, a politics of faddism, and we have to be aware of it.
Information sharing for all those who are interested in evidence for policy and development evaluation. There is a new platform for evaluation in India called the Evaluation Community of India, and if you're interested in more information, there is a sign-up sheet at the registration desk where you can enter your name and email ID, and we can send you more information about that. It's just a new community, just started in the past year or so, and we want to build a platform for information exchange and capacity building in this field. So please do send us your information. Thank you.
My name is Abhishek. I work with Population Council. My question, it's actually to maybe anybody can answer, but Dr. Indrani Gupta made a very important point. Like there are several evidence and in certain areas which actually do not need more evidence, and there are a lot of systematic reviews in MCH, either family planning or anything. And the point is, how do we influence the mindset of the policymakers? When we invite any secretary, joint secretary, additional secretary, anybody to any data-driven dissemination or anything, like hardly one or two attend, and then nothing happens. It stops there. So the big question remains, like, how do we influence the mindset of those policymakers and bridge the gap, which Dr. Rohini also mentioned, like the linkage between the research fraternity and the policymakers or the government. Yeah, thank you.
Sure. So this is Ambarish.
Hi. Yeah, I just taking off from the question that the gentleman from IDS asked, I'd like, coming from a background of anthropology, I'd like to know, is evidence for policy relegated to the study, to be studied by economists and public policy experts? Because I don't usually see sociologists or anthropologists, and I want to make a distinction between the two. We're long past the days that the two were the same here. I don't see those people at these. Don't get me wrong. We're flooded by economists here today. I'd just like to know. I'm sorry. My name's Gayatri.
Yeah. Hi, my question is to the panel. This is Ambarish. I work for AWAT in the department called Reimbursement and Healthcare Economics. While Ma'am Indrani was talking about the National Healthcare Protection Scheme, which was about to sort of come at least in this particular year, but nothing was there in the budget session as well this time. As one of the part of my job, I have been working with the payers across the country, like all the state payers and as well as the central government payers. While we are talking about generating evidence through randomized control trial, which obviously take a lot of funds to be allocated and huge time to be sort of spent with that, one thing which I would like to bring to notice is there is a lot of data which is already available with this scheme, which have been running since long in India. Like you have various southern states like Arogyasri from state of Telangana. You also have a scheme running in the state of Karnataka, and also almost all the major states in southern India, they have very well built social health protection scheme. So there is a lot of data which is available there. So using that data, don't you see that there is a lot of scope to sort of come up with some analytics out of that, and then sort of based upon the gaps you can identify whether there is a need for a RCT and whether there is an opportunity for collaboration with researcher and the private partnership as well as with the government community as well.
thank you very much for actually asking that question. It's allowing me to say a few more things that I wanted to say. But
Related to his question.
is that a dig at me? I'm going to ignore that. No, so I think that there's something special about participatory decision-making. There's one very special thing in the legal system, which is this whole thing of public interest litigation, which exists nowhere else that I know of, at least in the same form, where you can actually go to court on someone else's behalf. And so I think that there's something very special here that we do exploit from time to time. But whenever we actually experiment with it on the ground, I find that participatory decision-making, we have lots of evidence to show that it works well. And one example is poverty targeting. And so if you look at the NSS data on the BPL listing, and you look at the AAY listing, so this is the Antodaya Anna Yojana, so it's really if you're looking at the ultra poor versus the poor are terribly targeted. It's almost like randomly picking households. The ultra poor are actually pretty well targeted, and the targeting of the ultra poor goes on through these community exercises. So you go into a village and say, well, who's the poorest in your village? And whenever we do that, if you go to an individual and say, are you poor or not, and they get benefits, then they're very happy to say we're poor. On the other hand, if you're forcing them to say, well, we're actually poorer than that person who has nothing, they're much more reluctant to do it. So it's worked very well with poverty targeting. It works very well, this is coming back to what Gauri was saying, I think. If I used Google Maps coming here to find the shortest way. That's completely participatory. So technology has opened up huge possibilities for participatory decision making, and we can exploit them, and I'm sure that lots of innovative people will. Sudarshan, I'm going to come to in a minute. I wanted to address Gayatri's point about economists dominating the scene. And I completely agree with you. So one thing that I've been interested in a long time is caste inequality. And I started working at this in the 90s. And what we did was basically to go and look at documents, and you took categories very much as they were given in documents. So data is categorized always. And when you're looking at a complex thing like caste, for historically, people would classify them in a particular way. And it wasn't until I went away to a multidisciplinary institute for a fellowship for a year that I realized this was really wrong-headed. All the while, I've been assuming that this is the truth, whereas it was the truth in this very narrow sense of being collected in certain bins. And if I change those bins, things would change dramatically. So now when censuses change the way they classify, they allow people to classify themselves, they drastically change measures of diversity. And we would never get to that if it wasn't for this engagement across the disciplines. And for us, it happens only accidentally. And, we really need to do more to promote it. But again, we need to get, I'm using the economics jargon again and again, and I'm sorry, especially in response to this question, but we need to get the incentives right somehow. And people need to engage with each other and get something out of it. On how Abhishek asked and Sudarshan talked about the politics of evidence. And I think I'm more optimistic. A friend of mine many years ago when I was fresh out of my PhD, someone who was in their 50s said to me that I think there's a lot of win-win, but I'm worried about being talked of as middle-aged when I say that. And so I think there's a lot of win-win, and I'm afraid I have to admit I'm middle-aged, but I'm really optimistic. So I think there are lots of people in government who want to do good things, and there are constraints. I think there are lots of academics who are publishing in the best journals, but if you ask them, will you serve on a committee, will you help us out with this? At the Delhi school, we've got many Nobel laureates to come. We've never been able to pay business class, we've never had a 5-star hotel, and they've all come, So I think there's a lot of win-win, and I think, of course, there's politics of evidence, but the more we talk about it, the less of it there's going to be.
Thank you.
Participatory research that's what I took from your interjection, and I think I completely agree that there is a lot more evidence that we can get through participatory research. It reminds me of a thing that happened about 5 years ago, started by Population Council, where it was, NGOs that were actually working with communities and that they were engaged in a lot of this participatory research as well as policy making. The disconnect was complete. So their research, their evidence never gets up there with the national policymakers or even the state level politicians, decision makers. So the idea was that how can we massage this kind of evidence and data to make the NGOs actually come out with papers that are publishable and that actually can see the light of the day or even put in newspapers, etc. And about a whole week was devoted to what was called scientific writing. I mean, it's been done elsewhere all the time, but in India, there aren't that many instances. So I was there as a resource person, and what was completely mind-blowing was the amount of evidence NGOs that were working with really grassroots, the organizations that were at the grassroots working with people. We don't do that. I feel very humble because I really don't work with people down there. They had so much evidence of either this or that not working or working, but somehow those results have never found their way, through the kind of layers up there where it should make a difference. So Population Council, they funded it, but it's all over now. So I think there is a huge amount of scope to bring again the two communities together, the researchers, the NGOs or the community people and the government together. I think it's happening at the state level again, I must say, but it may not be happening at the national level as much as we want to. So there are ways, and I think the other stakeholders internationally can actually help in that process. I think they would do us a good service if they actually make this kind of thing happen more often. So that's to answer that question. Glamour in research is really related to that. Somebody asked this question whether the results that were not seen glamorous enough ever find their way to policymakers. Unfortunately not. And sometimes others have to tell us that, you've got a good thing, and which is really sad. Why is it that we can't come up with our own list of things that are important? The fact of the matter is there is international community that the UN organizations, they do, I wouldn't say influence, but they do often remind us maybe what's going on in the rest of the world, and that is when we actually look inside ourselves and bring up things. This should actually shift. This should happen within our country, with our country people. I'm sorry, I don't mean any offense to anybody, but it should happen much more there, and the government can be a key, catalyst in that process if it has a space for that. Evaluation committee, I don't know, I didn't get quite that. I will take this question on mindset and economists. Actually, I don't think economists are involved much at all in evaluation research in India. It just so happens that there are some economists today in this particular room, but I don't think that economists are given any time of the day by the ministry or anybody else. I think that there is a hierarchy. Possibly the sociologists are not given the light of the day at all, but I think economic evaluation is not a priority with many ministries. So then in some ministries, less in other ministries. Social sector is I think quite conspicuous by the absence of good economic research. Education sector, a bit has happened. Health sector, nothing has happened. And you can count the number of economists working in the health sector therefore. So I think we should work together. We have tried in IEG to take anthropologists, sociologists on board when we do our research, even clinicians and epidemiologists. So it has to be multidisciplinary depending on where you are. Lot of data. I think this is an excellent point. I want to harp on it over and over again at the cost of sounding boring. For instance, we were looking at universal health coverage and what kind of treatment-seeking behavior people have, demand, etc. We have been requesting government, like Ministry of Health, they are sitting on CGHS data, the Central Government Health Scheme. There is the ESIC data. There is the RSBY data. Why doesn't the government give this data over to us? Or the larger research community. We can work together with them and answer the question. They're just sitting on data mines, but we don't really, it's very frustrating to ask for microdata, household level data from the government, because I don't know, there is some feeling that, it's, we shouldn't be letting people know what's going on. It's not that. You remove the IDs and give it to us. We can do good research. So I buy that point.
Okay, thank you, everyone. I think actually now the time is more or less over, so unfortunately not around for another time for questions, but it was a very nice summary that we just received and response. And I think it was quite clear, and it's been in the responses, and it's been a theme, I think, throughout the morning, starting with Pierre and Santosh, that there's a broad range of evidence we want to look upon. And whilst people didn't explicitly name participatory methods or sociology or anthropology, it's very clear that that's part of the broader range of evidence we need to be drawing upon. And for these different types of evidence, we need to think about the ways in which we find pathways into policy. And Robert's point about not plonking reports, of course, I think is well taken. And people know by and large these days that plonked reports don't get much traction. You need to have a deeper engagement than that in terms of first setting the questions and then sharing findings as emerge and interpreting findings with policy and practice. But it's not for me to conclude, in fact, it's for Mani, so I'd like to invite Mani to come up and make some concluding remarks.
Thanks. Well, I think you all have to agree with me, this has been a pretty unique morning. I've been in Delhi for a year and a half, and this is and I go to maybe, in my job, at least 2 or 3 of these events a month in which there are presentations. And this is the first one in which we've had so many insights with not a single PowerPoint presentation. And I have to congratulate everyone for doing that. And I long for those days when we actually had conversations rather than death by PowerPoint. So I just want to say 2 things. One is I was asked to give my final thoughts on the substance of today, and secondly, to thank people. It's been a very rich morning, so I'm not going to do justice to any kind of summary, and I won't try to do that. And I just wanted to take a little bit of your time, just a couple of minutes, for 4 takeaways for me from the morning on really what is it taken to bring evidence to policy. And I took from the morning's discussion just 4 things. One is high quality evidence. Okay. And I think that we had discussion on we have to be very precise about what that evidence is. It's not just RCTs, but a whole variety of methods that addresses the counterfactual through other ways, but also I think Robert brought a very important point to bring in the participatory elements, because we have to get it not just at the what, but the why. So that's one thing in terms of high-quality research. The other is high-quality data. That information in this is very important. I think there are challenges in both of these because there are still disincentives to make sure that the data are as good as they are and as available as they are. Now, I'll return to that in a minute. So the first takeaway I have is that an important ingredient in bringing convincing policymakers is that you really have robust results and evidence. The second is that you have to have the right people in the right context, the champions, and Santosh started us off on this. He mentioned that there are potential sitting ducks out there, I think was the term you used, of people who might be receptive, but you have to know who they are, and for that I think the discussion was you really need to have deeper knowledge of the context, and that you have to have a mix of international and local researchers to make that bridge. It also helps to have buy-in from the top, and this wasn't so mentioned. And I reminded in the Philippines case when we were saying, look, the Philippines has been a very important outlier in East Asia on bringing this evidence. And I asked the minister, why is that? Well, he said this is in the previous administration, not the current one. When I go to a cabinet meeting, the president, then President Aquino, would ask people, okay, you're proposing this? What is the evidence on this? What has been known so far? And that made people sit up. So I think buy-in from the top is going to be critical, and I think going forward, I think that the message from the world is that that's a challenge in some countries and perhaps not in others. So that's the second lesson, is champions and identifying the right one. The third is engagement throughout the process. And I think Rohini and others talked about the disincentives, the various misalignment of incentives between policymakers and researchers. And what we at 3IE and Campbell and GDN try to do is try to align those incentives. We play the role of matchmaker, because it's not in every researcher's incentive to engage with the policymakers from the very start of a project to the very end. They don't want to get things done, they need to get tenure. It's not the incentive of every policymaker and implementer to ask those questions that might actually affect their well-being if they find the wrong results. And so I think they're bringing in also this issue of stressing the learning side rather than the accountability side is going to be critical if we're going to engage in the right way. And the last thing about this is, let's bring in the professionals. Let's face it, not every researcher is a great writer, or I know that for a fact myself, or a great presenter, but there are others out there who can actually bridge that gap between the hard work that's done and how to market it in an effective way. And I think it's one of the things that all of us learn. So the third thing is engagement. And the fourth is transparency. I think that we all talked about how to make sure that we have the right quality and the right data. I think one of the things that we all are coming to is that if we make a commitment to make the analysis transparent, and I've seen some governments which said, yeah, you can do this evaluation, but keep it in-house. And also to make even the data transparent, I think that will go a long way towards improving both. So those are just my 4 takeaways. In brief, it's high-quality research, getting the right champions, engagement of all the stakeholders throughout the process, and transparency of results. So with that, let me thank everybody. First, my co-conspirators and the other organizations. I hate to tell you this, but if 3IE was incubated in GDN, so if Howard is the father of 3IE, I'm afraid, Pierre, this makes you the grandfather of 3IE. I want to thank you for that. And let me just mention some names without which none of this could have taken place. So from GDN side, Francesco Obin, Madhuri Das, Tatum Street, and Yashika Kanoija. From the Campbell Collaboration, Ashrita Saran, Denny John, and from our team in 3IE, Beryl Leach, Durgadas Menon, Tanvi Lal, and Radhika Menon. So with that, I want to thank all of the panelists who have come as well and given their fantastic time, and all of you for participating. So thank you.